Not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening. Happy Thursday, everyone. Welcome to a special edition of You and Your Doctor, brought to you by All County Healthcare, a Medicare certified home health agency. You can reach them at 954-717-7027. I am Dawn Graubert. I'm your host tonight for Louise Gomez. We have a special edition of All County You and Your Doctor, brought to you by Dr. David Mandell. So I'm really excited to have you. Dr. Mandell happened to stop by the studio and we said, oh my gosh, let's share your expertise as a pediatric ENT or otolaryngologist. That is definitely a mouthful. I can understand why people are going to use ENT, abbreviated for ear, nose, and throat, but very subspecialized in everything that you bring forward.
Yeah, it's true. It's a unique specialty in that many of the things we treat are some of the most common diseases children have, and yet it's a very narrow subspecialty at the same time.
You know, I think when people think ENT, ear, nose, and throat, earache, sore throat, tonsils, your bread and butter, but your specialization is far more reaching than that, especially in pediatrics. Right.
General ENT doctors can take care of kids and adults and do see a lot of bread and butter things, and I still see plenty of that too. But after my residency training, I did an extra fellowship training at a children's hospital to be certified in pediatric ENT, which really means taking care of complex cases. We're talking like premature babies in the neonatal ICU who have respiratory problems. I have a lot of patients with tracheostomy tubes that I'm either putting in or taking out, and also like complex head and neck masses and vascular malformations, all the stuff that nobody else wants to do.
You know, we were talking before we started the show. My dad was a pediatrician, and I worked with him for years before I started in the world of production. And that is definitely a labor of love specialty, because you're not just working with your patient as an adult. It's an entire family, and those families are doting on their kids, especially you're talking about neonatal. There's nothing more terrifying than having a sick child at any age, but as a newborn or a preemie, you've got your hands full now helping them.
Yeah, it's interesting because once in a while I have to pitch in for one of my adult colleagues and I see an adult patient. They actually talk to me, tell me what's wrong. I'm like, this is so pleasant. Why did I choose babies? You know, because they don't talk. They just, but yeah, it's in this job, if you love talking to families and explaining things to them in great detail, then you gravitate towards this, because yeah, there's a lot of care, direct care going on with the infants and the children, including a lot of surgery, but most of who you're caring for really is the families and the parents.
Well, then let's talk about it. Why did you choose babies and children?
Well, let me put it this way. I mentor a lot of medical students. I did so in Pittsburgh and also here at some of the local medical schools, and they always ask me, how do you choose a specialty? And I think with the experience I've gained over the years, this is interesting. You don't choose a specialty based on, oh, I like working with kids, or I like this part of the body or that part of the body. You try to go on all your rotations, work with all the different types of doctors, and here's something interesting. Each specialty seems to attract a certain personality. It's really true. Like you just gravitate towards certain people. So if you're in a field, like on a rotation as a medical student, and you're not really getting along with everyone and you feel uncomfortable, it's probably the wrong specialty, even if you thought it was the right one. And so to answer your question about pediatric ENT, those are the people who were fellowship trained pediatric ENTs in my training program were the ones I felt like were happiest and who I connected with. I felt something inside of me like, I can work next to this person, and those are the personalities that were attracted to that. And I realized if I want to be happy, even though I hadn't envisioned myself working with kids, this is where I'm going to be most comfortable. Biggest mistake you can make as a doctor in training is like stick to some dream that you really want to be, I don't know, colorectal surgeon or a dermatologist, but the further you get along with your training, you're realizing you don't fit in. You have to choose, the specialty chooses you.
It has to, right?
As long as you keep your eyes open.
And what's interesting is this show we were talking about started out as seeing the other side of a physician. That physicians are people too, and you have another side of life. And you were performing in our studio with your daughter, who has a spectacular voice, and you were doing her accompaniment. So, not in the office today. You're behind our keyboard. Your daughter has a voice and a range like an angel, and you wrote a lot of her music.
Yes. Well, I wasn't one of those people who knew I wanted to be a doctor from an early age. Even in college, I didn't do pre-med. I just sort of decided at the end I wanted to do it, and luckily was able to get in. I'm not even sure if I'd be able to today, but it was competitive then, but it's crazy now. Yeah, so I did have an entire life before going to med school. And actually the first 6 months of med school, I continued to live a double life and do all my art and music and everything. But med school is hard. It's like insane. And I'd always breezed through school, gotten great grades. That's how I got into med school, even though I wasn't pre-med. But then after the first round of tests in med school, when I had never gotten grades that bad before, I realized, okay, I need to, if I'm really going to do this, I need to buckle down. And I made a conscious decision to really shut down everything else in my life and just focus on medicine, including music and everything else. And that's what I did for 15 years. And at the end of it, I came out. I was no longer a kid anymore. You change a lot. I was now a full-fledged adult. And then there I was. I got the training I wanted. Now, as time goes on, the other parts of my life have started to creep back in, and I've allowed that to happen, including helping my daughter play music the past. It's only been, less than a year I've been helping her, and here we are. And
like a true dad, your daughter's there, she's singing, and we were talking, you said, oh, I'm a physician. Now, a lot of dads, I think dads are all like that, but separately, you're the doctor, you're the physician, you're the gentleman or the female in that white coat, and that's who people go to. But here you were a dad first, and I think that's what resonates with our listeners and our viewers, is doctors are people and there's another side. So when you bring your children to a physician, or you bring your baby or grandchild that needs an ENT specialist, you step back and say, you know what? As the physician, you say, I know what it's like on their side.
Yeah, it's true. I think when I started having kids, it made me a much better doctor treating kids. You don't really understand until you see it yourself. And some of the people who trained me said when you're working on a patient, you're only like a half step removed from feeling like a parent. That's how invested you are and how well they do. True. So if you handle your personal life well and really care about your family and try to be a good person, it sort of spills over into how you treat patients. So yeah, I mean, I just try to treat everyone the same, whether they're a patient or a family.
And your training was extensive. From med school on, 4 years of med school, and then residency?
Right, 5 years of residency.
And that was in surgery or ENT?
ENT. One of the big dividing points when people graduate med school is, are you going to do work with your hands, be a surgeon, or are you going to be more intellectual? And I just didn't have the patience to, examine a patient for 5 minutes and then pontificate for 3 hours about what they had. I need action.
So you were a surgeon personality.
Everyone's like, oh, you're too nice to be a surgeon. So sort of, but I had a personality that needed action. So it was either going to be something like emergency room or surgery. And then, I narrowed it down to 50% of the specialties by eliminating the non-surgical ones. But then I had to decide what was I going to do within surgery. There's so many things to do. And this is, maybe not universally true, but my initial experience was that working with general surgery was a kind of a rough environment, but some of the surgical subspecialties were more friendly and gentlemanly, I guess you could say, and I started to drift towards those. And then it was going to be something, whether ENT or urology or who knows. And so it just kind of evolves. Again, not by necessarily choosing the specialty you want per se, but just trying to keep your eyes open and see which group of doctors do you feel most comfortable with.
It's so interesting because I remember back going through the med school days, right, there's this divide of the surgeon mindset versus the academic. But you did both.
Right. Well, those are like two different things. Like which specialty you go into can be divided into non-surgical or medicine, and then surgical. But then within each of those camps, there's another divide. Are you going to be primarily treating patients, or are you going to be an academician? There's plenty of surgeons who are academicians, and you become like the true clinician scientist.
And you did that.
I did for a while, yeah. Yeah, I ran a basic science research lab, and while simultaneously seeing patients and teaching and writing. It was, they call it the triple threat, publishing, doing surgery, and also teaching. And what's fun is you can be really great at all three things and really create quite a career, but there's only 24 hours in a day. And what gets sacrificed when you really do that well is everything else, including family. So I didn't enjoy how some of my mentors were amazing at their job, but didn't really have much of a family life. And so I tried to find a balance. That's why I left academics.
Which is important. And I think now the new generation coming forward, we were really briefly talking about it, it's different, the young generation going into medicine. There's a lot of physician extenders, your PA, your nurse practitioners, different intakes and scribes to the physician, and then your reimbursement. I think now physicians are truly looking at quality of life over income.
Yeah, it's just some of the older physicians are not looking very fondly at the newer generation, saying they're not working nearly as hard as us. How are they going to experience all the things we did? They're not going to see as many things, they're going to have less experience. They may have a point, but on the other hand, I'm kind of jealous of them because they're paying more attention to their quality of life. Luckily, I guess I had the mental fortitude to survive what I went through. Turned out okay. But there were plenty of people who it really took a toll, and maybe it did, and I don't realize it.
And you think about when you were on call, they were probably 24 hours on, 12 off, or 36 on, 12 off.
It was worse than that.
And right back now, I want to say unionized, but they definitely have their rules and regulations on. You can't do that for patient care, for quality of life for the physician, but mostly for patient care, I think it is.
Yeah, I mean, it all started with, I guess, the Bell Commission in New York City, which said that residents could only work, I think, 80 hours a week. I was in New York City, and that law had already passed, but guess what? We worked 120 to 140 hours a week.
Yeah, right.
And no one cared. I'm grateful that I went through it and survived, because I honestly do think I saw things and had experience that is irreplaceable. I really see it, I really think it made me have some special skills, but I wouldn't wish it on anyone.
But you think about the fortitude and what it took for you to get through this. Yeah. And now I sit with you and I'm like, well, he's a surgeon because you're so specialized, but you definitely have the demeanor of a pediatrician. Yeah. You're kind, you're gentle, you deliver the information, and you've really put both specialties together, and I can see why you are the pediatric ENT or otolaryngologist in our community, and you service how many hospitals?
It's got to be at least 6 or 7. I lose count sometimes.
And how do you possibly do this? And someone calls you, my kid, like my daughter when she's little, put a Barbie shoe up her nose. And I remember thinking, oh my gosh, what are we going to do? And luckily we had those those forceps, the long tweezers.
Oh, you took care of it yourself?
My husband, well, yeah, he took care of it. But I'm thinking otherwise I'd be calling you because there's a Barbie shoe up her nose. And that's like a minor thing, right?
But still, yeah, have to come in.
So I call you and I go to Boca and you're like, I can't get there right now. I'm at Bethesda or I'm in Jupiter. You're it.
Yeah, pretty much it. There's very few of us around, so just have to take the hit. One thing's for sure, though, it's like if I ever try to sacrifice caring for the patient in favor of my own comfort, it's not going to go well. You got to just take the hit and just forget about your own personal needs and take care of the patient and do it happily. And then later, when it's all over, you can relax.
It's a lot of work.
If you let your guard down and start paying too much attention to yourself and not the patients, bad things will happen. If you're taking on the responsibility of treating someone, it's got to be 100%.
You do a lot of NICU, pediatric ICU, as well as regular children
things,
and things they need.
What happens when word gets out that you can do some really, special things, then everybody wants to see you, and then you get flooded with all the bread and butter too. And there might have been a point in my life where I was really, geared up to try to do the most complicated things I could possibly find, and I was but at this point I just take pleasure in just making people better, and I don't care if it's something really, really simple or really, really complicated.
Tonsils and adenoids still big thing?
Yeah, they are. You have to have the right reasons to do it. You can't just take them out just because you feel like it. But there are very strict guidelines and criteria about who needs them and who doesn't.
All right, so what are some of those guidelines?
Well, you really want to know?
Yeah, if people are listening.
Okay, so there's only really 2 reasons generally to take tonsils out, according to national guidelines. And these guidelines are made every 10 years roughly by a group of doctors, including a lot of my friends who I know from academics. They review all the literature, thousands of papers, put it together and come up with like an expert statement. And the purpose of it, more than anything else, is to prevent doctors who are a little bit unscrupulous from doing surgery when it's not needed. You know, some people don't like guidelines. The doctors, they're like, don't tell me how to do my job. I know what I'm doing. But I love guidelines because they provide a framework based on evidence. So there's like meaning behind it. It's not just your opinion. And if you really are a true expert, you're allowed to break the guidelines, but you know what you're doing and can justify it. You don't have to follow them to a T. But anyway, 2 reasons to take out tonsils in 2025. The first reason would be too many infections. Okay. How many infections do you need? 7 in 1 year, 5 per year for 2 years, or 3 per year for 3 years. It doesn't have to be strep throat, but it's just, you know, an infection that caused you to miss school or have a fever. Okay. Anything less than that, we try to talk people out of it. The other reason you take tonsils out is when they're really big and you have sleep apnea. Not just snoring, but sleep apnea. Sleep apnea is a severe version of snoring. And who cares if a 4-year-old has sleep apnea? The reason why is because it's been linked to ADHD and a lot of other behavioral problems and poor school performance, etc. So when you remove tonsils and adenoids in kids with sleep apnea, most of them are cured. They sleep better, and then their entire daytime functioning improves. Now, how do you know if someone has sleep apnea? You can't tell just by looking at their tonsils and, oh, they look big. You gotta get a sleep study. So we order a lot of those and try to scientifically make a decision if surgery is justified or not.
In children, wow.
That's the story.
Why to remove tonsils in 2025? All right, more to come on the other side of this commercial break, brought to you by All County Healthcare, 954-717-7027. More to come with Dr. David Mandell on the other side of this break.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And welcome back to All County, You and Your Doctor. Tonight we're here with Dr. David Mandell. He is an ENT otolaryngologist specializing in pediatric care. But to reach All County Healthcare, you can find them at info@allcountyhealthcare.com or 954-717-7027. We're going to check back in with Dr. Mandell because your practice, your ENT practice, is specialized. So you're multi-specialty within the ENT field. You specialize in pediatrics. Tell us a little bit of the other physicians that you have within you.
Well, we wanted to try to model ourselves as like an academic practice at a university where everybody who works there has fellowship training in something. But we've only been successful at finding 4 pediatric ENTs, which is a very large number. And we also have 2 rhinologist. What a rhinologist is someone who completed ENT residency and then did a fellowship in basically endoscopic sinus surgery. And there's some cities where there's 0 of them. We have 2 in our group, so it's pretty amazing. They are truly amazing. I'm in awe of what they do. They do everything with endoscopes through the nose, but they literally remove like large brain tumors, eye tumors. They work on pituitary tumors. They're constantly fixing like CSF leaks, and the things that they do are just incredible. So they're amazing.
And they do that all through the nose?
Through the nose, yeah.
Wow.
And they have such fancy equipment. I mean, they have image guidance. So when they're in the nose working on the brain or the eye or the pituitary gland, there's this huge TV screen, and you can see the patient's CAT scan on there, and you can see exactly where they are as they're working, so they know where they are. I've shared a couple of patients with them because once in a while I have a pediatric patient who has some wild tumor or mass, and normally that's something I wouldn't have been able to fix, but since they're in the group, I bring them in, and I've been in the OR side by side with them just watching them work, and it's, well, I don't know, their fellowship training is impressive.
It makes
but unfortunately, we don't have any of the other subspecialties. We would love to have like a laryngologist, which is someone who specializes in care of the voice, but there's so few of them around and we haven't been able to find one. We would love to have a neuro-otologist who does like really complex ear surgery, but there's so few of them around. At one point we did have a facial plastic surgeon with us for a couple of years, but he left. So we do what we can.
And the children that you see with the helmets for their head shaping, does that fall within the scope of what you all do?
Not quite. That's called plagiocephaly. There's a lot of overlap between my specialty and pediatric plastic surgery. And you think plastic surgery for little babies, it's basically cleft palate repairs, cleft lip repairs, and also changing the shape of the skull. And so there's a couple of pediatric plastic surgeons who we're very close with. In fact, they work in our office, and they take care of all the helmets. So I'm like right there watching it, but I'm not the one you want to see if you need the helmet.
It's incredible the amount of specialization within the field of what there is. Tubes, still common, especially in Florida. Swimmer's ear?
Yeah,
or has it changed?
Well, swimmer's ear is when too much water gets in your ear canal and the skin gets infected, and it's treated with ear drops and cleaning the ear. The ear tubes you're referring to, that's surgical. That's not for swimmer's ear, that's for otitis media.
Because I think a lot of people combine those two. My kid has swimmer's ear, it's like, why didn't you take out your tonsils, right? My kids had swimmer's ears so many times this year, they need tubes. So
I had a conversation today with a 12-year-old, and their mom. People get really confused,
right?
Because an ear infection sounds like an ear infection, but there are different anatomical parts to the ear, and some of them are treated completely differently than the other. So as a parent, you're just like, my child's ear hurts, fix it. But the surgical ear tubes only work for one of those. And if you do it for the other one, it makes it worse.
Okay.
So
why do you need tubes in 2025?
Well, most commonly it's under the age of 4, because that's when kids have immature ventilation between the nose and the ear, and they're in daycare, and every time they catch a cold, it goes up to the middle ear sinus. You could think of those ear infections like a sinus infection. Starts with a cold, goes to the sinus in your ear, and you put a tube in the eardrum to drain the fluid and make it ventilate and feel better. Many kids outgrow that problem as they start getting between 4 to 6 years old, and so it's less common to see ear infections from a cold and therefore less likely to get tubes. However, as you get older, you start to swim more, and that's when you start seeing swimmer's ear, which is a completely different problem that's treated mainly with ear drops, not surgery.
Which is why don't go to Dr. Google. If your child has an ear infection or a sore throat, you really should call Dr. Mandell or his practice directly. What is the best way to reach your practice?
Our office number is 561-736-8141. And we do have a website, which I rarely go on, but I hear that we have something like 250 plus visits made per week on the website. So you can actually schedule a visit online. And the website, I believe, is Florida, spelled out, ENTcare.com. And there's some parents who stay on there watching it every day till a spot opens up and they snag it. They tell me that.
I was going to say, what does that look like as far as primary care needing referral to get to you, different insurances?
It depends on the insurance. Some insurances you need a referral from your pediatrician. Others you can just go ahead and make the appointment yourself. Every insurance is different.
And they can do it directly, which is great. You can kind of schedule your appointment
online.
Which is it's so different than when I had children and when you had kids. But I love the fact that we got to see both sides of your life today. We see you as the dad, the musician, and then have the pleasure of learning more about the specialty that you represent.
Well, thank you for having me, and I hope it was helpful to hear about this, in some way.
It was my pleasure. For more information on Dr. Mandell, you can reach them at the office. We give them which number? The not 561?
561-736-8141, or find us online. A lot of people have figured out how to do that. So.
Boca, Boynton, West Palm, Jupiter. Their office is far-reaching, any place in Palm Beach County. And for more information, just contact them, or you can always contact us right here at the studio. And to reach All County Healthcare, you can find them at 954-717-7027. They are a Medicare certified home health agency supplying all the needs that you would have, from skilled nursing to AIDS, healthcare, companion care, respiratory therapy, and everything in between. You can also find their website at info@allcountyhealthcare.com. Thank you so much, Dr. Mandell, for joining us.
Thank
it has
you.
been a pleasure. I'm Dawn Graubert for Louise Gomez and All County Healthcare. Have a great night, everyone. Stay safe, and we'll see you next time.